All right, tonight my guest is Dr. Erica Latcher. I am so excited to have her back, and she's going to kind of unwrap all of the acronyms. This is the best way to say it. So welcome, Dr. Latcher. Thank you so much for joining me.
Oh, you're very welcome. It's always great to be here.
And so can you just give a brief bio for the people who might not know you at this point?
I am a general equine practitioner in North Central Florida. And I'm also the co-host of the podcast Straight from the Horse Doctor's Mouth, along with my husband, Justin Long. We cover everything horse from top to bottom, stem to stern. You name it, we cover it.
Yeah. And your topics do range all over the place, and it's a really awesome podcast. And I think it's great for any horse person so that they can learn more about the things that are happening with their horse, or could happen, or hopefully don't happen.
Lots of times, hopefully don't happen.
Yeah. All right. So tonight we're going to talk about, even the ROSM, I get stuck on that acronym. So let's just start there.
So when we are talking about the biologics, which is sort of the category we're going to talk about tonight, there are a whole lot of them. And there are more acronyms coming along all the time. So I always tell owners, don't get hung up on the acronym. Get hung up a little bit on the product and the science behind it.
So let's just start with the term biologic. What do you mean by and your camera went a little fuzzy. I don't know if your focus shifted.
Oh, is it back now or no?
I don't know.
I have to go get IT to fix the camera.
Yeah, no, you were fine, and now you're a little fuzzy. I mean, it's not the end of the world. Okay. All
right. Well, it'll be a little fun. We'll call it like, the old time movies where they put the Vaseline on the camera. Yeah, we'll just do that.
Okay.
So biologics mean that it comes from your horse and it is processed in a way from your horse. So we can draw blood or we can take bone marrow. Those are the two big ones we do. And when we draw blood, we're typically going for more of the liquid portion of the blood. So there's the cells portion and there's the liquid portion. And for the most part, we're going for lots of the liquid portion. We may do things to that liquid portion to make it better. But biologic means that it's coming from a horse typically and going into a horse. And most of the time it's coming from your horse and going into your horse. There are some newer products available that are Amnion derived. And so those are coming from the amnion of donor horses. So like if think about some of these large breeding operations, they can take their amnion and some of the blood from umbilical cords, and the companies use that to make a product that is from a different horse, but still biologic that we can put into another horse.
Okay, awesome. And I figured out what the fuzzy was. It was at my end and I blipped out, but I'm back. So hopefully that.
And my cat is going to come help here. So
okay, great. So a cat tail always helps.
Yes.
All right. So biologic, we're talking about substances that come from the body.
Yep. Yeah.
Okay.
And most of the time, like I said, in the horse world, it will be coming from your own horse. We'll take it from the horse, put it back into the same horse. Occasionally with some of the amnion products, it will be from a different horse.
Okay. So, all right, continue on, please.
So from there's a lot of, like I said, acronyms. And we started with things like stem cells, things called IRAP, PRP, which is just platelet-rich plasma. IRAP stands for interleukin receptor antagonist protein 1, although there's a bunch of them. And the basis
fast. Whoa.
So the basis for all of them is that what we're trying to do is take the body's natural mechanisms for shutting down inflammation and repair and putting them into an area that has something wrong with it, whether that's a joint or even a uterus or a tendon or a ligament. We're trying to take the body's own natural systems, we're trying to amplify them, and then we're trying to put them back in to the same horse we got them out of.
So obviously there's a cost involved. So this isn't like your first thing you want to do if there's something that you notice something with your horse, is it?
It depends on the horse, to be honest. One of the big reasons that we have gone to these as a first line product, and yes, there is cost involved. We can get to that next. But one of the biggest reasons we've gone to this as a first line product is that we have significantly lower risks for a lot of the issues we have with joint injections in particular. And the two big risks we have with joint injections are that we can potentially cause an infection, and that we, and especially in metabolically affected horses, we can potentiate an episode of laminitis. And it is very often not a tiny episode of laminitis. It is a really bad lose the horse episode of laminitis. And joint infections are always life-threatening in horses. So biologics, for the most part, not completely, but they take both of those risks off the table.
So I didn't realize that you could have a severe laminitic response from joint injections. I guess that's something I haven't heard about. How I guess I want to know, like, what are the statistics? How common is that? You're making bad faces, so I'm thinking
it's not. So both of those side effects are not common, right? They happen in probably infections happen in less than 0.01% of joint injections. The laminitic episodes are more common. And in particular, if we're looking at a horse that is one of the sports that we think of as being a bit over-conditioned. So think about your hunters and your dressage horses. We tend to like them to be a little bit on the plump side from an aesthetic viewpoint. And so they are more prone to having metabolic issues. One of the things we don't know is when we are injecting these horses, we can do some stall side testing now, but does that horse have a high insulin level, indicating that we have a metabolic issue at the moment we're injecting them? When we do that, if we're using steroids, then we are creating and amplifying that metabolic issue that's already there, and we can put them into a laminitic crisis. And again, I won't say it's many, but these are two huge risks. If you want to know what keeps veterinarians up at night after they've injected your horse's joints, it's these two risks.
Yeah, so, infection is something that obviously when you invade a joint capsule, there's always the risk of infection, right?
Yeah, and then the problem is that those steroids that we put in there, they take the immune system and just turn it off. That's how they work as an anti-inflammatory. So if we put those into a joint, we are just shutting down inflammation from the immune system. Inflammation is a response by the immune system to something wrong. And so our steroids go in and say, no, everything's fine, calm down. But they scream it at the immune system and they say, go, get away, get out of here. And so we end up with no immune system in the joint at that point. And if we have a bit of bacteria that comes in, and it's impossible to get any skin sterile, we can't do that.
Right.
So if bacteria comes in, we don't have a way for the joint to combat it appropriately because we put steroid in there and said, no, go away, immune system.
Are there statistics on the percentages of, because joint injections are done a lot, and right. You don't hear about them going bad very often. So, obviously it's a risk, and anytime you are invading a joint, it's a risk. I might blip out on you again. Keep talking. When you go fuzzy.
So it is a risk.
Yeah.
Yeah, and it's like I said, the joint infections are 0.01%. So that's a low rate. I don't know that there's a known number out there for laminitis risk, but more and more commonly, if I'm looking at a horse that is overweight, before I put steroid in that horse, I'm going to want to know what the insulin values are for that horse and see if I can establish if they're metabolically compromised or not.
And that's something that testing for insulin is getting better and better stall side. We didn't used to have that.
Right? Absolutely. And it has been a game changer for us. And like I said, it may be a case where I'll say, okay, it looks like we're doing all right. Let's go ahead and talk about steroids and if that's the right answer. Right. The other thing about steroids, though, is that all they're doing is going in and shutting down inflammation. That's the only thing they do when they go in a joint. They don't fix anything. So let's say we have a tear, and I'm not talking about like giant rips and tears. I'm talking about micro damage. But we have a little bit of a tear to the cartilage. We have a little bit of a tear to the synovium. We've got little tiny things here and there. Steroids are not going to fix that. They're just going to tell the immune system to calm down and stop being so upset about it. So they're going to reduce that inflammation. And then for us to repair, we've got to look to the biologics. And that's where they shine, is that they can help us with some repair.
Oh, nice. Okay, so you're not just sort of putting a Band-Aid on it. You're actually getting the body to help heal itself.
Exactly.
Okay. So in these biologics, are there different categories of biologics? Are there different?
There are, in general. There's sort of the blood products, the amnion products, and the stem cell products. Like I said, the stem cell and the blood products tend to come from your horse to your horse. And the amnion products are really quite good. There's two big ones out there. One company is called Renovo, and the other is Hilltop Bio. The advantage that they have for us is that they give us a lot of the things that stem cells do without some of the problems that stem cells have. So stem cells are, everyone's heard of them, right? Like they're these amazing creatures. And in many ways they are. But the way we get them is that we have to draw a sample from your horse. First off, it comes from the sternum. So it comes from, kind of right here. So you have to get up between their front legs and get that sample. You can imagine on some horses that's less fun than you would like it to be.
Oh, yeah.
And then we have to, so we get that sample. We then send it off and it gets cultured. And what we're doing there is growing up the stem cells. So we may start with, I'm going to do easy math because it's the only way I function. We're going to start with 100 stem cells. When we send it off for culture, we're going to end up with 100,000.
Oh, okay.
Yeah. And we want some specific types of stem cells versus others. And so they help with that part of the process too. So, but that takes time. Versus with some of these newer amnion products, we can get a lot of those same benefits, the anti-inflammatory, the potentiation of repair, all the things you think about when you think about growing a baby. There's a lot involved in that process. So that's what we're going for, is that process that Mother Nature has that grows a kid. We're taking that and using it for repair. So we can put that into what they call a lipophilized product. It looks like a powder. We can carry that in our trucks or stock it on our shelves. We can add a little bit of saline to it, shake it up, put it in there, and get a lot of those same benefits of stem cells with a reduction in cost on one a little bit. And then we can also, like I said, do it immediately.
Wow. So the amniotic, clearly it's coming. How do they collect that? I guess is.
That's a great question. They have donor mares, and when they foal, they're taking the amnion, and then they process it in a lab. Essentially, you dry it with the process is a little bit complicated, but basically you dry it with fat, and then turn it into a powder in an industrial sized blender.
Okay, so we're not losing any babies or anything like that. This is a natural product that's coming from foals when they're born.
Yeah. It's not like the PMU type scenario where you have mares that are out there specifically doing this. There's plenty of, if you hook in with like a recipient mare facility, there's lots of large organized reproductive facilities. And so if you hook in with one of those, it's pretty easy to get a whole lot of amnion.
Okay, great. Yeah, that's what I was kind of driving at, is like, how are they getting this, and is it compromising
ethical
horses? Yeah.
Nope. No horse is compromised.
That's great. Okay, so we've got PRP, amniotic, and stem cells. Those are kind of our three buckets.
Well, so what we have is blood products, stem cells, and amnion. So the blood products are probably, I would say currently those are the most common. And the way they work is that you have multiple commercial companies that have a way that you can produce these through what they call kits. So one of the most popular ones is what's called Prostride. And essentially what they all are is their proprietary method of taking blood from a horse, mixing it with special activators. And then I always say we do some magic, but basically involves some centrifuging, like in that centrifuging process, we take certain parts, we don't take certain parts, then we centrifuge again, we do all that again. And at the end of it, we have various different products. And like I said, there's Prostride, there's A2M, there's PRP. There's probably more that I can't think of right at the moment, but they're, essentially all of those are taking blood, doing something to it to amp up the natural processes that are in the bloodstream anyways for healing and anti-inflammatory properties, leaving us with that and then using that product to put it into an area that we need to heal.
Okay, so it's a fairly, I wouldn't say easy process, but it's become a very there's an SOP.
Yep, exactly. Yep.
Right. So you just run the SOP for whichever brand you're using, and you start with the horse's blood, and you come out with a product that you can put back in to help reduce the inflammation and increase the healing.
Yep, and that is where there's a few sticky points there.
Okay.
Those kits are proprietary for most of them, and so the cost certainly comes from there. Like we have to pay a relatively high fee for those kits, the centrifuges that we use, all of that kind of stuff. We then need to do this under extremely sterile circumstances because, we're pulling this from your horse, we're doing stuff to it, we're putting it back into the joint. And while one of the big advantages of these products is that they don't tamp down the immune system in the joint, we're still putting these products into a joint. And so we want them as sterile as we can possibly have them.
So you actually process this stuff in your lab, in your clinic?
Yes. And lots of people do it, in their truck, in the barn. I'm not as comfortable with that. If I have my option, I would way, way, way rather do that in the clinic because we pull it in our barn aisle and then we go back into our lab and do all the processing in an area that is way cleaner than even the cleanest barn.
Right. Because you don't want to introduce anything into that product that you're going to put back in the horse.
Right. But we can do it, like we pull the blood, we process it, and we come back out, and we can get all that done in about an hour and a half.
Oh, so not bad. Not a horrific. It's like, that's not long, really. When you think about what you're doing, that's not long.
We usually send you out to lunch.
Yeah.
We're like, go get some food.
And you probably know the best places down there to go to lunch.
Yeah.
All right. So now, so we've got these blood products. Why would I choose a blood product over stem cells over amniotic?
Some of that comes down to the affected portion and kind of what's happened. So for most joints, what we end up with is an acute inflammatory reaction. So the joint gets real pissed off, basically. And there may be a little bit of damage in there, but for the most part, we have a joint that's just mad at the world. And so, like I said, we have that option at that point where we can put steroid in that joint, but we run the risk, especially in the older, if we have an older horse that has Cushing's, we have an overweight horse, we have any horse with a history of laminitis, we run the risk of laminitis. And with those steroids, we're not going to be fixing any of the damage that has occurred during this process. And we can fix that with biologics. So for us, we will tend to reach for them for a joint that we're trying to manage on, like I said, either that older horse or something that we are worried about a metabolic process. We'll reach for the steroids if we have what we can't find as a degenerative process. We can't find a straight up injury in that joint. When we shoot x-rays, it looks good. When we do an ultrasound, it looks normal. We may reach for steroids in that scenario, but we're going to go with a relatively low quantity and see if we can just get the inflammation to stop. So for joints, 9 times out of 10, we're going to reach for one of these PRP, IRAP, Prostride, one of these blood type products. Now, if we're looking at a joint, and a stifle is one of the most common ones I'm thinking of that has a cyst in it. So we have these developmental cysts that they get in their femur, that we need to regrow. We're not going to regrow perfect bone, but we need to grow more stuff. And so for those horses, we're going to reach for stem cells more often because we need to put in a whole lot more structure. We aren't just healing, an abrasion. We are healing the knee getting annihilated, for example, right? So we didn't just skin our knee, we took it out. Right. And so we're going to reach for something that can build a lot more structure for us, and that's going to be stem cell. It is happy in the joint, but you can't put stem cells in and then say, okay, I'm going to go ride that horse in a couple of days like you can with the blood origin products. Now, the amnion products, the most common place we reach for them is for tendons and ligaments. And it's because it gives us a lot of good things. So it gives us scaffolding that, I always age myself apparently when I say, if you build it, they will come.
Get it? I totally get it.
But stem cells are an if you build it, they will come type scenario. So the amniotic products give us the scaffolding that stem cells really like. They give us the signals that stem cells need to come to an area. And then they give us a whole bunch of factors that promote healing and reduce inflammation. And they have more of that than, for example, like PRP would be our next one down. Now, we could put stem cells in that tendon or ligament, but what we often find when we do that on some of these structures is that the stem cells don't stay around because they're really picky. Oh. They like to have, I always say they like to have luxury accommodations. And they're more of a condominium than a house. They want everything taken care of. They don't want to have to deal with the lawn or the pool or any of that. They want someone else to do that. And that's what Amnion does for us. It sets up that luxury condominium experience for the stem cells. And if you build it, they will come.
Oh, wow. So if you do the structural stuff with the Amnion, you'll still get stem cells coming in from the body itself and going, exactly. Wow, this is a nice place to hang out. It's kind of like a coral reef. You need some coral there for the fish to come in. And so the stem cells are like the fish populating the coral reef, which is the amnion.
Exactly. So if you put the fish in with no coral, they're like, why are we here?
Yeah.
We're going to go over there.
Well, it's so interesting. So, before you do this, you have to have some good diagnostics to know what you're dealing with in order to make these choices. So what is the process like? All right, I show up and my horse is like off, he's not right. And you're going to, what is the process you're going to go through and sort of in terms of making these decisions?
Well, the first thing we always start with is a really good exam because as you know, just because they're lame in, let's say, the left front, we may have compensatory things going on in the other three legs. So we're always going to start with a really good exam. We go nose to tail, top to bottom. Take a look at everything that's going on. For example, today I had one come off the trailer and very obviously had a left hind lameness, but she also had a right pole kind of deal from having to compensate for all that. She was really tight on the right side of her head. So from there, on that horse, for example, we looked at all of her legs. I made sure she had good range of motion everywhere else. We didn't, we kind of picked up on some little stuff elsewhere, but nothing major. So then we took her out and we said, all right, let's see you move. So we always watch them walk or trot, or walk and trot. And I always watch a straight line up and back. And then I watch trot up and back. And then we start to flex. And nearly always I will do both of a leg. So for example, this horse was lame on her left hind. So we started with her left hind and we run through a series of flexions, starting at the bottom of the leg. Then I'll flex hind legs, we'll flex a little harder. Hind legs, I may also pull them behind or take them across the body to see how they respond to those different flexions. And that helps us isolate where we want to go next. Because believe it or not, even though vet bills I know can be the bane of everyone's existence, we really do try to spend your money wisely. So from there on this horse, we isolated that it appeared most of her pain was coming from her stifle. Now, if it had been lower on the limb, we would have done some diagnostic nerve blocking. Also, this patient was not particularly amenable to diagnostic nerve blocking, which involves putting needles in while they're awake. And she was not going to allow that to happen. So on her, we started with some imaging. So we did an ultrasound of her stifle, and then we actually added x-rays, and I'll talk about that in a moment because of the ultrasound. So on the ultrasound, we saw that she had a bit of a tear in her meniscus, just like a football player gets. So when we completed that, we didn't see much else going on there, but we went ahead and shot some x-rays because it can tell us some more information about how that meniscus is tying into the bone. And we wanted to see if we had some bone component as well. On her, it didn't look like we did. So if we had some bone component, I may have reached for a little bit of steroids with what I eventually chose so that we could reduce inflammation, and it may have changed our plan. So on her, we actually did PRP because it was in a joint, and this is my comfort level. I am a little more comfortable with the blood products in joints than I am the Amnion products. I have started using them a little bit in joints, but they've only recently been approved for joint use. So I am still a little bit tentative about what joints I put them in. And in meniscus cases, I've had pretty good luck with PRP. So much like Amnion, it does a bit of that building the structure that stem cells want so that we have a place for them to come. So we did PRP, and then because she didn't have a bony component, we stopped there. So if she had a large bony component, I probably would have started with a little bit of steroids on her because that's the best product I have to shut down that bone pain level inflammation. And then we would have had to come back in a few weeks and put the PRP in. And the reason we would have had to separate those is that the steroid would have negated the effects of the PRP. Because it's shutting down that natural response of the body, and it'll shut down PRP too. So that's where all this gets a little bit complicated.
Yeah, because you don't want competing storylines in there.
Yeah.
And so when you do PRP, what is the horse goes home, right? Can they go back to work right away? Is there a rest period? What's the process?
So for most of these, like this horse has a pretty bad injury, but for a lot of these, we put the PRP in. Theoretically, because of the way those products work, you can put them back into work the next day. I tend to say that I have a joint or, I have a structure, joints in particular, tendons and ligaments, not so much. Those are all going to have to go through a rehab process. I tend to say with joints, if I had a joint that was that upset that I felt the need to go into the joint and inject it, I would really like it to have a few days rest so it can kind of reset, come back online without all that inflammation before we go back into work.
Yeah, that makes sense. I mean, rest is one of the best cures for a lot of things, and combining that with something where you're asking the body to respond. So so you put the PRP in and it builds some scaffolding and it calls in the stem cells and they basically go to work to just regenerate the meniscus?
They don't necessarily regenerate it to factory default, but they help the body lay down scar tissue. And with meniscuses, that's okay. It won't be, like I said, it won't be factory default, but it'll be functional. As long as the tear isn't a huge one. If you have big tears, that's a whole different story. But, in this case, we had a relatively small tear. We had a joint that had a reasonable amount of inflammation. And I felt like I could get the most bang for the client's buck by doing PRP versus if I had done just steroids. Yes, I could have shut down the inflammation, but I wouldn't have helped that meniscus and I wouldn't have helped what was likely some damage to the synovium as well.
So is it fair to say that you're moving more and more toward these types of products and getting away from steroids if you can?
We definitely have moved more towards these products. And like I said, the big thing for us is it takes some of those risks off the table. But I also feel like in the end, it's better for the horse, right? Like we are taking that damage and we're giving it an opportunity to heal as opposed to just putting a Band-Aid on it so that we don't see it. So when you talk about these horses who are getting joints injected with steroids, and we never use the word maintenance, but people will talk about their horses need to get their joints injected once a year, every 6 months, something like that. We haven't done what we need to do for that joint most of the time. We have an arthritic situation that's been created because way back in the beginning, we didn't necessarily do what we needed to help that joint heal and move forward properly. Now, some of it is confirmation and, what we ask horses to do, all of that. But in general, if I'm looking at a 6-year-old horse that is having to get its joints injected every 6 months, then I have deep concerns. And many of these products have helped us move away from that type of cycle because we're not just putting a Band-Aid on it. We're actually helping it heal.
Yeah, I think that's really valuable. There's so often, especially people who are getting an older horse, right? You get a horse and you're purchasing it because it's got mileage. But the problem is it has mileage,
right?
Right. And it's a double-edged sword because if you don't know what the program was for this horse, say early on, what kind of stresses its joint was under, is that, it can catch up with you on the backside and bite you in the butt. Right.
And these products keep that bite in the butt from happening sooner. And for many of these horses, like you look at some of these horses and there was one that was owned by Miss Mars that was doing 5-star events until he was 18, 19 years old. That's what these products do for us, is that they help us get these horses going longer and better.
So is it something that someone might actually use prophylactically? I mean, you wouldn't go and use it if there wasn't a problem, would you? Or if you...
Right. No. Okay. And that's where I go away from. I don't think the joint maintenance should be a thing. If there isn't a problem, don't look for a solution.
Right. Because so many people want to I want to make sure I take the best care of my horse. So let's go ahead and do this. But if his horse doesn't need it, basically you're wasting your money, and there's still always the potential, right? As soon as you're injecting anything into the body, there's always a potential for a problem.
Absolutely. And like I said, that's what keeps me up at night when I've done a joint injection.
Yeah. So aside from infection with these biologics, are there any other risks or concerns?
The biggest side effect we have is something called a flare. And that can be hard to tell the difference between an infection and a flare in the moment. But a flare is basically just that the body's own immune system reacted to the product we put in there. And that just happens with these. So think about, it's basically a little bit of blood, whole blood got into there in the wrong way. And even though you may not be able to visibly see it, the body sees that there's white blood cells, red blood cells, things like that are in the product, and it doesn't want those in there. And so it overreacts. The nice thing about those is we manage them with some anti-inflammatory, like bute, Banamine, that kind of thing. And they do really well. They also do that at about 24 hours post-injection, versus infections tend to show up in the 5 to 7 day range post-injection. So
if you have a flare pretty fast.
Typically, but you still have a heart attack if you're a veterinarian.
I am sure. I can imagine there are many things that keep you up at night in this business. Unlike cow, I remember when I was thinking about going to vet school and I was driving around with an old cow vet, and he would take the same needle and go through like 20 cows till it was so blunt he couldn't stab them anymore. And then he'd chuck it out and get another needle. And I was just like, oh my God. It's like a horse would faint on you if you even thought of somebody else's needle.
Exactly.
So it's so different.
But yeah, so these products definitely help me sleep better at night. But flare is one of the biggest side effects that we worry about with them.
And so if somebody's, so basically you get a good diagnostics, and okay, maybe I should ask it this way. How accepted are these biologics in the veterinary world, equine world at this point? Are they? They're
extremely well accepted. The thing that you have to watch with them, and this is where the acceptance becomes something we need to be careful of, is that there is a new one coming out all the time. And so my job as your veterinarian is to do the research to make sure that the latest greatest really is, that there's a research behind the latest greatest to say that it truly is. There's snake oil salesmen still out there. And This industry is, or this component of it is ripe with it, because we can't test for it. And by its very nature, it's not USDA or FDA testable, right? Because we're pulling it from a horse and then we're doing things to it. We're putting it right back in the horse. So we can't test it and standardize it before we do that. That is one of the advantages to the Amnion product. It is standardized in the bottles that it comes in. But so I don't know necessarily when I pull ProStride that it has this many units of IRAP and this many units of, this anti-inflammatory cytokine or that one. I don't know for sure. What I have is work by the company that is published that shows me that in 100 horses, this is what they got for averages. So they did the work to show that they could reliably get this information, or this quantity from there. But that brings us to a little bit of a biologic problem, in that my cat is also helping again. Sorry about that. So that does bring us to a little bit of a biologic problem, in that the horse is a fairly dependent part of that. So PRP from Flicka may not, and almost definitely isn't the same as PRP from Sapphire over there. And a lot of things matter, like, was the horse exercised today? There's some work to show that if they've been exercised within the last 24 hours, we have lower quality biologics from that horse. And these are some of the tricky things about biologics, that we don't know what's going on with that horse at that moment when we draw the blood, in terms of what the quality of the product is on the other side. Now, with things like PRP, I can actually test. So we test platelet numbers in the blood when we start. We process it and we test platelet numbers at the end of that to see if we got a good quality product.
Well, that's fascinating. So, wait, what was the question I just had? Because it just, so basically what you're saying is that it's going to vary horse to horse because of the horse you're taking it from.
Yeah.
Whereas the Amnion's a little more consistent because there's a process by which it can be uniformly standardized.
Yes, and stem cells as well, because they're cultured. So we pull the stem cells, we send them off, and when they reach a certain number, the lab sends them back to us.
Okay. So, and
again, we don't know, like if I buy a kit from Bob on the corner, it may not do anything.
Right. So these companies obviously they are doing testing and doing research in order to make claims about their products. Oh yeah, that was my question. So in terms of drug testing, say you could have a competition horse, is that a problem with using any of these with a competition horse?
That is the other nice thing about biologics, is we don't run into any of the withdrawal times. And in particular, we run into withdrawal times from our sedatives more than we do from the products we're putting into the joint. And in particular, when we're talking about FEI horses, that can be really, really, really important, because we have such long extended withdrawal times.
Right. So you avoid that. I can remember, so actually it was 2019 and I was talking to my orthopedic surgeon who did a little work on me, and I mentioned these ideas and he totally wrote it off as bogus, woohoo crap stuff. But clearly in the veterinary world, where there is no placebo effect, you can't tell the horse, hey, this is going to make you feel better, right? And then he feels better. It's funny because there seems to be much more resistance in the human world and much less resistance in the veterinary world. Any thoughts on that?
I think some of it is that you can ask a human, ask any NFL player, you can ask a human to push through pain, right? Mm-hmm. Like I can take that human and I can put a steroid shot in their knee and I can say, it's the Super Bowl. I think you can do it. And to some extent, they're going to push through that pain to do what they need to do. They're also going to understand a little bit more, and I think we can argue that's not always true, the price they paid to be there. When they're they're 45 and they can hardly get out of bed because every joint hurts because it's been injected a bunch of times. I think that they were a little bit more active participant in that process. So from a horse standpoint, we can't get them to play through the pain. Now, I recognize that some horses will play through it to some extent, but when you're talking about high-level performance horses, let's take a dressage horse, for instance, we need them to be even in that piaffe and passage. And if they are a little bit painful, even if they're that uber performance horse who really, really, really wants to do what you're asking, you're going to see that unevenness from the pain. And so we need to come up with better ways to manage the pain. And I think this is better, right? Like the steroids, like I said, Band-Aid doesn't often give us long lasting effects. This, we have true repair and we can get longer lasting effects for these horses. So I think there's that component. And I think from a standpoint of equine welfare, the biologics are almost always going to be the better answer for a long-term career for that horse.
And so when you do, say, PRP, let's take this horse with the stifle injury. How soon do you ultrasound it again and expect to see an improvement? How long does that take? What's our, do we have to do it again?
That's a great question, which I don't have an answer for. In terms of how long are we going to have to do it again? So typically we bring those horses back for a meniscal type injury. We'll bring them back in 5 or 6 months and see what we have. Those are slow healers for us. But in the meantime, we'll also get that horse started on some rehab. Okay, sorry, hold on one sec. The cat's got to go down. He's being way too helpful. He's fighting that. It says no. Sorry about that. Cats. Okay. Can't tell them no either. So for that horse, like I said, 4 to 6 months, we'll bring that horse back. But in the meantime, we're going to get her started on some rehab process too. This is one of those places where I love the Surefoot pads because I can, start them on that without having them do a lot of movement to that joint, but we're helping them to build strength and stability. So we're starting the rehab process low and slow. And what we find with these is that we shorten these lengthy rehabs by a little bit, not a lot, but the quality of the end result is better. So when you look at, like, racehorses are the thing we tend to look at because they're easy to quantify, right? Like they went out and they earned this much money before we did a process or a procedure. They went out and competed similarly or not, and you don't have to track down the owner. It's published work, right? Mm-hmm. So when we look at those horses that have been treated with biologics, for example, tendon or ligament injuries, we find that they come back a little bit sooner, but they tend to come back better than horses who are not treated similarly. So they go back to earning money at a similar level. So you take a grade 1 stakes winner, and now they're going to drop down probably a class, but they're not going to drop down to claiming races.
Oh, well. Yeah, I mean, and the thoroughbred industry is a great place to see because you it's a measurable result, right? So many other situations you don't have that tidiness, if you will, of cause and effect. Exactly. So we haven't talked about price. I suppose it's about time that we dive into that one.
I tend to anticipate that for these, you're probably looking at triple, if not quadruple, the price of steroids. Now, for some of them, it's the processing fee up front, and we can get multiple doses of things. So for like A2M, PRP, IRAP even, some of the other kits on the market, you can start, you have an upfront cost that is high, but you get multiple doses of product. So for like that meniscus horse, we were able to get 4 doses of PRP. So if we need to go back into her, and we may, if she doesn't come around like we'd like her to, then we're probably going to put a little bit more product in there. But we have that, and then it's just the injection fee. So, we're able to bank a bit of it, and that takes some of the sting out of it. In the freezer.
Oh, that's easy.
Yeah.
Yeah. Okay, cool.
Yeah. And they're all pretty good about being in the freezer. And the Amnion products, you're typically looking at about double into the triple range, depending on how how big an injury you've got. So for example, I just had a horse that did its entire superficial digital flexor on a front leg from top to bottom. And, so we had to use quite a bit of product in that horse. But, if she'd had a tiny lesion, probably we wouldn't have treated that with steroid, but we probably would have added another $300 to $400 to the price of therapy.
So in dollar value, steroid injections are approximately.
Let's say if steroid injections, like I said, I got to do easy math. Steroid injections are $100. Biologic products are probably in the $400 to $500 range. But for most of them, you are getting much longer lasting results. Right. So I can keep a joint happy for, 18 months to 2 years. If I've got, like on a lot of these, you end up with a problem that I can get happier, but I can't fully fix it. Some of that is conformational. And so on those, I can keep those joints a lot happier for a lot longer than I can with steroids.
So basically, we're looking at a better outcome because we're actually repairing versus just palliative, get rid of the pain. And we're looking for longer. So when we take those dollars and spread it over the duration, it's probably even or better.
Absolutely.
And I think that's, so many people are looking at the upfront cost, but it's hard for them to see the long-term costs. I find that in my situation as well at times. And it's when you think about it over that time period, it's a no-brainer, right? Yeah. Yep. Yeah. You got to boost the credit card a little bit, but.
Well, and like I said, as humans, we're not great at that, right? That's why the subscription model exists. But it definitely, I think, gives us way better outcomes for these horses. And I think just does everything we've always wanted steroids to do and never gotten from them. And, so for me, it is, if I can use it, if possible, it is the best right answer for nearly every horse I see.
And is there anything coming down the pike that's even better at this point?
Oh, yeah.
Oh, what?
The research in this is insane, in particular in humans, for human athletes. So they're always, the research is aimed at finding that just right anti-inflammatory / regenerative molecule that, we can purify quickly and easily and put it in. And so there's always sort of the next version. So currently that's A2M. Which is alpha-2 macroglobulin, I believe. But, like I said, there's always sort of that next one, and there is very active research going on this. There's a whole group of researchers that focuses solely on regenerative medicine.
Yeah, because, in humans, we're looking at our population aging and they want to stay active, right? So there's a huge market in the human world. And then the dog world. People don't want their dogs to get old and decrepit, right? They want to keep them active with them. So I guess we benefit in the horse world from the research that's going on in the other fields.
Yep, absolutely.
Yeah. And again, we don't have placebo effects. So I'm sure these companies are looking at equines as a way to prove out their product and be able to say, hey, there's, it's worked in horses. There's no placebo. It should work in people.
Yeah. And it's a great way to see, us horse people. It's a great way to kind of see what works on an athlete that we ask to do a lot of the equivalent things that we ask a human athlete to do.
Right. So I guess there's one question that I have is that, obviously conformation is going to play into whether or not horse injures himself in this regard, right? In terms of damage. But are there things that we could do so that we never wind up on this track?
Yep.
And what would be the top 2 or 3 things that we could be doing so that we either minimize, avoid, or delay?
Number 1 for me is proper foot care. The number of horses I see that have toes that are too long, and some of it is bred into them, and again, it's conformational, but understanding and having radiographs to help guide a proper trim for your horse. And then we always say it's the trim. So it all starts with the trim, then you put the shoes on a proper trim. So bringing that weight down the horse's limb where it should be is huge, because every time they take a step with that toe a little bit too long, they're putting too much pressure on every part of their body all the way up. So I'm a huge, huge proponent of regular radiographs, good vet farrier client relationship, and really, really working on getting a really good foot underneath that horse. Next, I think, and this is going to be a combo pack, I'm going to get the horse first, but next the rider. The horse traveling in a proper way, right? So the horse has the training and the strength to know where their feet are, and they can handle themselves in a variety of circumstances. And again, and Wendy didn't prompt this, but this is where I like the Surefoot pads, because one of the things they do is help us train these guys with proprioception. You know, we give them neurofeedback to where is your foot and what is it doing, so that when you're asking them to take that quick turn to the left and the footing gives out just a little, you know, they've got the structure in there to catch it. And I think that's where fitness comes in. And most of us are very guilty, especially, you know, those of us who are not professionals. You know, my horses live in my backyard, and it's hard for me to get enough fitness on them, but I work diligently at it, because I think they need to be fit enough and trained enough, you know, and by that, I mean, like, their body is trained enough to do what we're asking them to do. And the third thing is that we as riders can be the best riders we can be. We are all crooked. And the more we can learn how crooked we are and how to fix it, the better we can sit on our horses evenly. Because again, it all comes down to forces going where they shouldn't go. And so the foot does that. The horse does that by not necessarily knowing kind of where they are in space, or not being fit enough to hold themselves there. And then we as riders are guilty of the same thing. Most of us sit harder on our left hip, I believe. You know, so we're constantly sitting hard on that left side of our horse. We're putting more weight on that left side. While it's not a lot, it's a little bit times a whole lot of time. And so the better we can be, the better our horses can travel, and the better they can support all those forces.
Awesome. Yeah. And, you know, foot care there's been a lot of attention on it, and there needs to be more, is kind of, you know, because I'm involved from Surefoot. I'm involved with a lot of farriers and trimmers and that sort of thing. And I think I'm sort of in a little bubble, because the people I'm with are, you know, do you see that improving? Do you see foot care getting better as a whole?
It depends on the day.
Okay.
I have some really great farriers, and I have an equine podiatrist that I work very closely with. She's truly a podiatrist. She's a certified journeyman farrier and a veterinarian. And, you know, so we work with some incredible people. And then I go out and I see a horse that has 2 miles of toe. And, you know, I'm like, oh, geez, you don't need me to inject this horse's hocks. You need to get his feet done.
Right. You know, and it's education. And I find with horses, we get so caught up in tradition that sometimes our persona gets wrapped up in our tradition instead of looking at, you know, what's coming down the pike and what's best for the horse. And so it's kind of an interesting, I guess the way I'm going to put it is, like with Surefoot, there's nothing like it. So nobody has any attachment. They might reject it wholeheartedly. That's fine. But they can't say, well, you know, my grandfather used this, and right. I don't get that. They're just either like, this is too weird for me, or it's okay. But there's so many other places where we can't see what's in front of us because we've been so conditioned by tradition.
That's us horse people in a nutshell.
Yeah. But hopefully, you know, one horse at a time, one rider at a time, one trainer at a time, we keep marching forward and bringing about change in our industry. And, you know, we have to, I think, is kind of the bottom line.
For the good of the horse. And that's what I'm here for the good of the horse and for just the welfare of all. Hang on. The print in the chat is tiny, so I'm just going to get my cheaters because I got cataract surgery, and now I don't need my glasses for 99% of
things, which is awesome. Answering questions.
Maybe I should get cataract surgery.
Oh, it's amazing. I can see distances now without them and read most everything. But this is on my laptop and it's kind of tiny. It says, quick question I didn't know I had. All right, Terry, what is your question? Let's see this. Answering questions that so much has changed in 40 years. Yeah, so grateful for this talk. So I guess Terry Carrie didn't have a question, but we answered questions she didn't know she had. I got it.
We answered them before you even had them. How about that?
Really?
It's Clairvoyant Monday.
Yeah, and it's go ahead.
It is a complicated topic, and that's where, if you have questions about your horse and the product that's about to be used, I always say, ask me, talk to your veterinarian about it. We're here to answer questions that you may have about it. And we don't ask you to be experts on biologics. My mom's an accountant and she doesn't ask me to be an expert on taxes, thank God. So, that's what we're here for. And if we can't answer your questions to your satisfaction, then everybody needs to go home and do some research and decide if it's the right product for you. And it may not be. Right. But, asking for the information always should be on the table.
And you bring up a really good point, that you should feel safe enough to ask questions. And then the flip side of that is everybody goes to Dr. Google and tries to solve their problem. So where's the balance in there between going out and doing this ton of research and coming to your vet and telling them everything that they should be doing versus asking your vet?
There's no great answer on biologics, to be honest. I think it's talking with your veterinarian about the risk versus rewards that are available there, and getting from them why they think this is the best option for your horse. And again, for me, it's going to be that I think that I can get your horse a better long-term outcome, but we can also talk about what your horse has been doing. If your horse is an older, very Cushingoid, we've had trouble managing it, we've got a lot of health conditions going on, then it may be that this isn't the answer, because if we're pulling a biologic from your horse to put in your horse, we're probably not going to get a very good biologic. So having that conversation and, just discussing all the points, I think is the best way to go about it. And, like I said, you don't have to be an expert, but you do have to get a feeling for how you feel about it by the end of the conversation.
Awesome. Well, this has been a fabulous webinar. I've learned a ton because, like I said, I hear these acronyms thrown around and I'm like, I don't, it's just alphabet soup to me. So this has really helped clarify it for me. So I really appreciate you taking the time to educate us on biologics. Thank you so much.
You are very welcome.
Yep. All right, everybody, just remember to tell your friends that you can, this and all the other webinars, you can find them at wendymurdoch.com/webinars. We post them there. If you sign up for any webinars, we're going to start sending out a monthly email with just a list of the webinars that we've had for that month. So you have quick, easy links. Share it with your friends, and we'll be back. I know we have more guests lined up, but I can't tell you it is right now. But anyway, thank you so much, Dr. Latcher. It's really great to see you. Have a great night. Bye.